When do you know it's abnormal?
Really, you need something else, some other objective evidence, meaning another piece of information. And so in our evaluation of mild cognitive impairment, we look for something called biomarkers.
So a biomarker, that means a living marker. Give me an example.
So it is an objective measure of pathologic processes or diseases, so an objective measure of disease. We use biomarkers in our everyday life. If you have a bathroom scale, that's a biomarker.
Sure, it tells me if I'm too fat.
But let's say if you had a particular condition and you suddenly gained weight, it could perhaps indicate there was something else wrong. So it's objective. And
what are some biomarkers that you look for, or that you can find?
One of the key things that we look for are imaging biomarkers. And one simple screen is a MRI or a CAT scan of the brain where we look for areas of shrinkage or atrophy.
So there's shrinkage of the brain and atrophy of the brain as in Alzheimer's disease.
Yes.
That are having something to do with dementia. So what do you see in the brain on this imaging that's interesting that you can find out?
So with normal aging, there is some mild global atrophy, but in early Alzheimer's or in mild cognitive impairment that will become an Alzheimer's case, we look for shrinkage of something called the hippocampus.
The hippocampus, where is that and what in the world is it?
So the hippocampus is a very tiny structure deep in the temporal lobe, and that's right above your ear area. We have one on each side, and it is the area that stores working memory. So,
So if something's going to go wrong with the hippocampus, you may not have a recall on the working memory. What does it look like on the brain? Does it get bigger or littler?
It shrinks
So
and
it
shrivels. In Alzheimer's disease, it's very specific, and it's an area, think of it as a hard-working area of the brain, so it's under stress, and in Alzheimer's disease, it's really stressing it, and it tends to atrophy.
So you can look for the
Shrinkage.
hippocampus shrinking. What happens to the inside of the brain, the ventricles?
So sometimes you see enlargement of the ventricles or the fluid areas increase because the actual brain mass has decreased. The other area that we look for shrinkage is in the parietal lobe, which is sort of towards the back part of the brain. And this area is important for processing, let's say, visual maps. So think of when we have perhaps lose something or misplace something, we have to retrace our steps.
Yeah.
And if the visual map of our brain is not working, you can't really find that map, and you can't walk backwards in time.
That's a beautiful description, because a lot of times when I'm forgetting something, I can say, now, where was I the last time I had this? And I go through my visual pathway. What's spatial problems? What is that spatial?
Yeah, that's part of the spatial problem. For instance, in that visual map problem, individuals that have mild cognitive impairment do just fine going to normal places, but may get lost going to places that they go to infrequently, because we are very good at doing those habitual things, like going from point A to point B, home to work, home to church, home to the bank. But if anything changes in that pathway, we get turned around. I don't know if you've ever been in the car where you've driven passively, you sort of arrive.
Yeah.
We're counting.
How did I get here?
Yeah, exactly. We're counting on those areas of the brain to take us there. So if you damage those portions, you can't get there.
And so if I find myself not knowing if I came there in a car, or knowing if I had a car, or don't know where the car could possibly be, or if I have a car, that would be an abnormal sign.
Yeah, that would be an abnormal sign. Yeah, absolutely.
Unequivocally so. So when somebody recognizes that in the family, what's the importance of recognizing it and getting the biomarkers and the studies to see if they do have the diagnosis? Is there early treatment? Is there a reason we want to find it early? What can we do?
So we can do so much to slow down Alzheimer's. We think that there are huge risk factors. About a third of Alzheimer's cases are from 7 preventable risk factors. So we really want to implement healthy habits early, and many times maybe someone was resistant to smoking cessation, stopping smoking. This usually scares folks into smoking cessation. Or maybe someone is having a very poor diet. Many times Alzheimer's will scare someone into really changing their lifestyle.
So good lifestyle, like no smoking, exercise, watch what you eat, lose weight. Word games, do they help at all?
I think they help a little bit, but the key is exercising the brain. And if you really enjoy word games, and if it's coming easy to you, then it's probably not a good brain exercise. If it doesn't hurt a little bit, it's probably not a good brain exercise.